In the last 5 years, according to the Substance Abuse and Mental Health Services Administration, about 107,000 adults per year were treated for mental health related issues.
Of those individuals, only 49.3% received treatment and 44.5% actually felt like their health improved. Alyssa Kozak tells us more. Alyssa, how much are Iowans spending on mental health care?
Well, Kaylin and Christina, Iowa currently spends about $1.3 billion on mental health services, which prompted a cost-efficient system to be made. I found out how it works. Mental health institutes are where families can admit loved ones who suffer from a mental health illness so severe it is dangerous not only to themselves, but to those around them. The MHIs try to help patients reach their highest functioning level through quality care. To do this, Iowans had the option of reaching psychiatric care at mental health institutes in Mount Pleasant, Cherokee, Clarinda, or Independence. But due to budget cuts, problems attracting psychiatrists, and dwindling populations, the Mount Pleasant and Clarinda facilities closed earlier this year.
The closure of the MHIs has put families in a precarious position. If they had loved ones who were there that ended up getting transferred to other facilities, maybe in another part of Iowa, so you've got transportation barriers.
1 out of 4 families has a member with mental illness. Mental illness is more common than other health issues like cancer, diabetes, and heart disease. And at any moment, almost 21% of hospital beds are filled by patients with a psychiatric disorder. This is the #1 reason for hospital admission.
You could be seriously depressed and suicidal. You could be psychotic, hearing voices, seeing things, paranoid, doing some erratic type of behaviors, all because of your mental illness. People usually don't want to be in the hospital, but when they feel so bad or they don't feel like there are any options for them, that's a safe place to be.
So what does this mean for families? Those who are in the southern counties now have to decide on if the family member or patient is in need of a high-level medical treatment or if a local hospital psychiatric ward will help. With the closure of 2 institutions, it has created a shortage of beds for patients, but this increased the Independence MHI by 30 adult beds. If a family does decide to go to the hospital and the particular hospital does not have an open bed, the hospital will find them one.
Usually it's up to the emergency room to find a bed for a patient in Iowa.
This prompted the Department of Health Services to create a bed tracking system statewide at the institutions in all of the 29 hospitals with open beds in the psychiatric wards. Now with the bed tracking system and the closure of the Clarinda and Mount Pleasant institutions, it is projected to save the state $7 million. If you or someone you know is in danger to oneself or others and you want to help, contact your nearest hospital. In the Cedar Valley, you can go to Covenant Hospital, Allen Hospital, Waverly Health Clinic, and for senior citizens, the Satori Memorial Hospital. And for the severe cases, Kaylin, Iowans can go to the Independence Mental Health Institute.